Good morning. Today I'm going to talk about some illness. First, I'm going to talk about acne, also known as acne vulgaris. It's a long-term skin disease that occurs when hair follicles are clogged with dead skin cells and oil from the skin. It is characterized by blackheads or whiteheads, pimples, oily skin, and possible scarring. It primarily affects area of the skin with a relative high number of oil glands, including the face, upper part of the chest, and the back. The resulting appearance can lead to anxiety and reduced self-esteem. Genetics is thought to be the primary cause of acne in 80% of cases. The role of the diet and cigarette smoking is unclear, and neither cleanliness nor exposure to sunlight appear to play a part. In both sexes, hormones called androgens appear to be part of the underlying mechanism by causing increased production of sebum. Another frequent factor is excessive growth of the bacterium Cutibacterium acnes, which is normally present on the skin. Many treatment options for acne are available, including lifestyle changes, medication, and medical procedures. Eating fewer simple carbohydrates, such as sugar, may help. Treatments applied directly to the affected skin, such as benzoyl peroxide and azelaic acid, are commonly used. Antibiotics and retinoids are available in formulations that are applied to the skin and taken by mouth for the treatment of acne. However, resistance to antibiotics may develop as a result of antibiotic therapy. Several types of birth control pills help against acne in women. Factors that may worsen acne. These factors can trigger or aggravate acne. Hormones, certain medications, for example, drugs that contain corticosteroids, testosterone, and lithium. Stress can make acne worse, and the diet, because studies indicate that certain dietary factors, including skim milk and carbohydrates-rich foods such as bread, bagels, and chips, may worsen acne. Well, how acne develop? These factors have little effects on acne. Greasy foods. Eating greasy foods has little to no effect on acne. So working in a greasy area, such as a kitchen with fry bats, that's because the oil can stick to the skin and block to the hair follicles. The cosmetics don't necessarily worsen acne, especially if you use oil-free makeup that doesn't clog pores and remove makeup regularly. But some cosmetics interfere with the effectiveness of acne drugs. Well, the risk factors are the age. People of all age can get acne, but it's most common in teenagers. The hormonal changes, such changes are common in teenagers, women and girls, and people using certain medications. Family history. The genetics plays a role in acne. If both parents had acne, you are likely to develop it. Stress, friction or pressure on your skin. This can be caused by items such as telephones, cell phones, backpacks. Also greasy or oily substance. You may develop acne where your skin comes into contact with oily lotions and creams, or with grease in work areas, such as a kitchen with fry pan. Now we are going to talk about AIDS, and for talk about AIDS we have to talk about HIV, the human immunodeficiency virus that infects cells of the immune system, destroying or impairing their functions. Infection with the virus results in progressive deterioration of the immune system, leading to immune deficiency. The immune system is considered deficient when it can no longer fulfill its role of fighting infection and disease. Infections associated with severe immunodeficiency are known as opportunistic infections because they take advantage of a weakened immune system. But what is AIDS? This is acquired immunodeficiency syndrome. It's a term which applies to the most advanced stage of HIV infection. It is defined by the occurrence of any of more than 20 opportunistic infection of HIV related cancer. How is AIDS transmitted? Can be transmitted through unprotected sexual intercourse and transfusion of contaminated blood and the sharing of contaminated needles, syringes, surgical equipment, or other sharp instruments. It may also be transmitted between a mother and her infant during pregnancy, childbirth, and breastfeeding. How many people are living with AIDS? According to estimates by WHO and UNAIDS, 36 million people were living with AIDS globally at the end of 2016. The same year, more than 1 million people became newly infected. How quickly does a person infected with HIV develop AIDS? The length of time can vary widely between individuals. Left without treatment, the majority of people infected with HIV will develop signs of this illness within 5 or 10 years. Also, this can be shorter. Now we are going to talk about allergies. An allergy is an immune system response to a foreign substance that's not typically harmful to your body. These foreign substances are called allergens. They can include certain foods, pollen, or pet dander. Your immune system's job is to keep you healthy by fighting harmful pathogens. It does this by attacking anything it thinks could put your body in danger. Depending on the allergen, this response may involve inflammation, sneezing, or a host of other symptoms. Your immune system normally adjusts to your environment. For example, when your body encounters something like pet dander, it should realize it's harmless. In people with dander allergies, the immune system perceives it as an outside invader threatening the body and attacks it. Allergies are common. Several treatments can help you avoid your symptoms. There are some kinds of allergies, for example, for food. Food allergies can trigger swelling, hives, nausea, and more. It might take a while for a person to realize that they have a food allergy. If you have a serious reaction after a meal and you are not sure why, see a medical professional immediately. They can find exactly the cause of your reaction. For seasonal allergies, for allergies on your skin, for example, may be a sign or symptoms of an allergy. They may also be the direct result of exposure to an allergy. For example, eating food you are allergic to can cause several symptoms. You may experience tingling in your mouth and throat. You may also develop a rash. The cause of allergies, there are a lot. For example, animal products. These include pet danders, dust, mite, waste, and cockroaches. Drugs like penicillin and different kinds of drugs. Foods, for example, milk, eggs, nuts. Insect stings. These include wasps, mosquitoes, and bees. Plants, pollen from grass, weeds, and trees, as well as resin from plants such as a poison ivy and poison oak, are very common plant allergens. Other allergens can be latex, metals like nickel, also there are seasonal allergies, also known as high fever, are some of the most common allergies. These are caused by pollen released by plants. They cause itchy eyes, watery eyes, runny nose, and coughing. Allergy treatments, medication. Allergy treatment often includes medication like antihistamines to control symptoms. The medication can be over the counter or prescription. What your doctor recommends depends on the severity of your allergy. Immunotherapy, emergency epinephrine, natural remedies for allergy. That's all. Now we are talk about anemia. Anemia is a condition in which you lack enough healthy red blood cells to carry adequate oxygen to your body's tissues. Having anemia can make you feel tired and weak. There are many forms of anemia, each with its own cause. Anemia can be temporary or long-term, and it can range from mild to severe. See your doctor if you suspect that you have anemia. It can be warning signs of serious illness. Treatment for anemia range from taking supplements to undergoing medical procedures. You might be able to prevent some types of anemia by eating healthy, varied diet. The symptoms of anemia are severe. For example, fatigue, weakness, pale of yellowish skin, irregular heartbeats, shortness of breath, chest pain, cold hands and feet, and headaches. The causes of anemia occurs when your blood doesn't have enough red blood cells. This can happen if your body doesn't make enough red blood cells. Bleeding causes you to lose red blood cells more quickly than they can be replaced, and your body destroys red blood cells. Well, the anemia have different causes. Iron deficiency anemia. This most common type of anemia caused by shortage of iron in your body. Your bone marrow needs iron to make hemoglobin. Without adequate iron, your body can't produce enough hemoglobin for red blood cells. Another cause is the vitamin deficiency anemia. Besides iron, your body needs vitamin B20 to produce enough healthy red blood cells. A diet lacking in these and other key nutrients can cause decreased red blood cells production. Another causes is anemia of inflammation, also aplastic anemia. This is very strange. Also we have anemia associated with bone marrow disease, the hemolytic anemia, and sickle cell anemia. The risk factors that can increase risk of anemia: a diet lacking in certain vitamins and minerals, a diet consistently low in iron, vitamin B12, and folate increase your risk of anemia. In intestinal disorders, having an intestinal disorder that affects the absorption of nutrients in your small intestine. Menstruation, in general, women who haven't had menopause have a greater risk of iron deficiency anemia than the men, and postmenopausal women. Menstruation causes the loss of red blood cells, as we know. Pregnancy: if you are pregnant and aren't taking a multivitamin with folic acid and iron, you are at increased risk of anemia. Appendicitis happens when your appendix becomes inflamed. It can be acute or chronic. For example, in the United States, appendicitis is the most common cause of abdominal pain resulting in surgery. Appendicitis symptoms. If you have appendicitis, you may experience one or more of the following symptoms: pain in your upper abdomen or around your belly button, pain in the lower right side of your abdomen, loss of appetite, indigestion, diarrhea, constipation, abdominal swelling, inability to pass gas, vomiting, low-grade fever. Appendicitis pain may start off as mild cramping. It often becomes more steady and severe over time. It may start in your upper abdomen or belly button area before moving to the lower right quadrant of your abdomen. If you are constipated and you suspect that you may have appendicitis, avoid taking laxative or using an enema. These treatments may cause your appendicitis to burst. But what are the causes? In many cases, the exact cause of appendicitis is unknown. Experts believe it develops when part of the appendicitis becomes obstructed or blocked. Many things can potentially block your appendicitis, including a bile duct or hardened stool, intestinal worms, traumatic injuries, tumors. When your appendicitis becomes blocked, bacteria can multiply inside it. This can lead to the formation of pus and swelling, which can cause painful pressure in your abdomen. Test for appendicitis. If you suspect you might have appendicitis, the doctor can recommend you a physical exam. They will check for tenderness in the lower right part of your abdomen and swelling or rigidity. Also, you have to take a urine test, a complete blood count, pregnancy test, pelvic exam, abdominal imaging test, chest imaging test, and others. The treatment option for appendicitis. Depending on your condition, your doctors recommend treatment plan for appendicitis may include one or more of the following: surgery to remove your appendicitis, needle drainage of surgery to drain an abscess, antibiotics, pain relievers, liquid diet. In rare cases, appendicitis may get better without surgery, but in the most cases, you will need surgery to remove your appendicitis. This is known as an appendectomy. If you have an abscess that hasn't ruptured, your doctor may treat the abscess before you undergo surgery. To start, they will give you antibiotics. Then, they will use a needle to drain the abscess of pus. Surgery for appendicitis. To treat appendicitis, your doctor may use a type of surgery known as appendectomy. During this surgery, they will remove your appendicitis. If your appendicitis has burst, they will also clean out your abdominal cavity. In some cases, your doctor may use laparoscopy to perform minimally invasive surgery. In other cases, they may have to use open surgery to remove your appendicitis. And that's all in the case of appendicitis. Thank you for your attention. Asthma is an inflammatory disease of the airways to the lungs. It makes breathing difficult and can make some physical activities difficult or even impossible. To understand asthma, you need to understand a little about what happens when you breathe. Normally, with every breath you take, air goes through your nose and down into your throat, into your airways, eventually making it to your lungs. There are lots of small air passages in your lungs that help deliver oxygen from the air into your bloodstream. Asthma symptoms occur when the lining of your airways swell and the muscles around them tighten. Mucus then fills the airways, further reducing the amount of air that can pass through. Asthma symptoms. The symptoms of asthma include coughing, especially at night when laughing or during exercise, wheezing or whistling sound made when breathing, shortness of breath, fatigue also. The type of asthma that you have can determine which symptoms you experience. Not everyone with asthma will experience these particular symptoms, but if you think the symptoms you are experiencing could be a sign of a condition such as asthma, make an appointment to see a doctor. The cause of asthma. No single cause has been identified for asthma. Instead, researchers believe that the breathing condition is caused by different factors. These factors include genetics. If a parent has asthma, you are more likely to develop it. History of viral infections. People with a history of viral infections during childhood are more likely to develop the condition. Hygiene hypothesis. It proposed that babies aren't exposed to enough bacteria in their early months and years, therefore their immune systems don't become strong enough to fight off asthma and other conditions. Early allergen exposure. Frequent contact with possible allergens and irritants may increase your risk for developing asthma. Asthma triggers. Certain conditions and environments may also trigger symptoms of asthma. These triggers include illness, respiratory illness such as the flu and pneumonia can trigger asthma attacks. Exercise, increased movements may make breathing more difficult. Irritants in the air. People with asthma may be sensitive to irritants such as chemical, smoke, for example. Extreme weather conditions such as very high humidity or low temperatures may trigger asthma. Allergens like animal dander, dust mites, and pollen, for example, and emotions, laughing and crying may trigger an attack. The treatment of asthma. Treatments for asthma fall into three primary categories. Breathing exercise. It can help you get more air into and out of your lungs. Over time, this may help increase lung capacity and cut down on severe asthma symptoms. Rescue or first aid treatments. This medication should only be used in the event of the asthma attack. They provide quick relief to help your breathing again. And long-term asthma control medications. These medications should be taken daily to prevent symptoms. Some rescue treatments, such as inhalers and nebulizers, can be used daily. However, your doctor will need to adjust your dosage. Well, that's all. Back pain. Back pain is a common reason for absence from work and for seeking medical treatment. It can be uncomfortable and debilitating. It's when you have a pain in your back. It can result from injury, activity, and some medical conditions. Back pain can affect people of any age for many different reasons. As people get older, the chance of developing lower back pain increases due to factors such as previous occupation and degenerative disc disease. Lower back pain may be linked to the bony lumbar spine, disc between the vertebral ligaments around the spine, and disc, spinal cord, and nervous lower back muscles, abdominal and pelvic, internal organs, and the skin around the lumbar area. The causes of back pain. The human back is composed of a complex structure of muscles, ligaments, tendons, discs, and bones, which work together to support the body and enable us to move around. The segments of spine are cushioned with cartilage-like pads called discs. Problems with any of these components can lead to back pain. In some cases of back pain, its cause remains unclear. Damage can result from strained medical conditions and poor posture, among others. A number of structural problems may also result in back pain. Ruptured disc. Each vertebra in the spine is cushioned by disc. If the disc ruptures, there will be more pressure on a nerve, resulting in back pain. Arthritis. Osteoarthritis can cause problems with the joints in the hips, lower back, and other places. In some cases, the space around the spinal cord narrows. This is known as spinal osteogenesis. Osteoporosis. Bones including the vertebra of the spine become brittle and porous, making compression fractures more likely. Another causes can be the movement and posture you have. For example, muscle tension, twisting, the form how you coughing or sneezing, pushing, pulling, or carrying something, standing or sitting for long periods, long driving sessions without a break, even when not hunched, sleeping on a mattress that does not support the body and keep the spine straight. Another causes can be cancer of the spine. A tumor on the spine may press against a nerve, resulting in back pain. Infections of the spine, and many others. Risk factors. The following factors are linked to a high risk of developing low back pain. For example, occupational activities, a sedentary lifestyle, older age, obesity, smoking, genetic factors, pregnancy. Well, now bleeding, also called hemorrhage, is the name used to describe blood loss. It can refer to blood loss inside the body, called internal bleeding, or to blood loss outside of the body, called external bleeding. Blood loss can occur in almost any area of the body. Internal bleeding occurs when blood leaks out through a damaged blood vessel or organ. External bleeding happens when blood exists through a break in the skin. Blood loss from bleeding tissues can also be apparent when blood exists through a natural opening in the body, such as the mouth, vagina, nose, for example. What are the common causes of bleeding? Bleeding is a common symptom. A variety of incidents or conditions can cause bleeding. The possible causes include traumatic bleeding. An injury can cause traumatic bleeding. Common types of traumatic injuries include hematomas, bruises, gunshot wounds, crushing injuries, puncture wounds from items like needles, knives, nails, for example. Medical conditions. There are some medical conditions that can cause bleeding. For example, leukemia, deficiency of vitamin K, brain trauma, lung cancer, hemophilia, and more. Medicines. Some medicines can be responsible for bleeding. For example, blood thinners, radiation therapy, aspirin, antibiotics. When is a bleeding a sign of an emergency? If bleeding is severe, seek help immediately. You should seek emergency help if you suspect internal bleeding. This can become life-threatening. People who have bleeding disorders or take blood thinners should also seek emergency help to stop bleeding. Seek medical help if the person has gone into a shock or has a fever. The bleeding cannot be controlled using pressure. The wound requires a tourniquet. The bleeding was caused by serious injury. The wound may need stitches to stop bleeding. The wound appears to be infected. Foreign objects are stuck inside the wound, and if the injury occurred due to a bite from an animal or human, maybe. How is bleeding treated? A person can bleed to death in 5 minutes. The first aid for traumatic bleeding. It's possible to treat external traumatic bleedings. Seek emergency help if the person is having any of the emergency signs listed before. Use the following to put pressures onto the wound: a clean cloth, bandage, clothing, or the hands. You can not have to remove the clothes when bleeding stops. Use an adhesive tape or clothing to wrap around the dressing and hold it in place. Then place cold pack over the wound. Look at the wound to see if bleeding has stopped. Then remove the cloth from the wound. Move anyone with an injury to the head, neck, back or leg, and apply pressure to an ice injury. Maybe you can use tourniquets. Well, that's all for the bleeding. Thank you. Now I'm talking about blisters. Where do blisters come from? A blister is a pocket of fluid between the upper layers of skin. The most common causes are friction, freezing, burning, infection, and chemical burns. Blisters are also a symptom of some diseases. The blister bubble is formed from the epidermis, the uppermost layer of skin. Its purpose is to protect and cushion the layers below. Blisters can be filled with serum, plasma, blood, or pus, depending on how and where they are formed. This stops further damage and gives the tissue time to heal. The causes, there are many activities and ailments that can induce blistering. For example, friction. Any repetitive friction or rubbing can cause blisters. These blisters will usually appear on the hands or feet, as these are areas that most often encounter repetitive abrasion, whether walking, running, or playing the drums. Areas of skin with a thick horny layer attached tightly to underlying structures are more likely to generate blisters. Another cause is temperature extremes. The timing of blister formation helps categorize burns. Second-degree burns will blister immediately, but first-degree burns blister a couple of days after the incident. At the opposite end of the spectrum, frostbite also produces blisters. In both cases, the blister is a defense mechanism deployed to protect lower levels of skin from temperature-related damage. Another cause is chemical exposure. Skin can occasionally blister because of certain chemicals. This is known as contact dermatitis. It can affect some individuals on contact with the following: cosmetics, detergents, solvents, flavoring, insect bites and stings, chemical warfare agents including mustard gas, also the nickel sulfate used in electroplatins. Another cause is crushing and pinching in small blood vessels near the surface of the skin is ruptured. Blood can leak into the gap between the layers of skin, causing a blood blister to form. Medical conditions. A number of medical conditions can cause blisters. These include herpes, chickenpox, dermatitis, bullous pemphigoids. The types of blisters are friction blisters, blood blisters, and head blisters. Other types of blister are named after the condition they are linked to, such as chickenpox and shingles blisters. Well, the prevention of blisters, avoiding blisters on the feet, you have what is a broken leg? A broken leg is a break or crack in one of the bones in your leg. It's also referred to as a leg fracture. A fracture may occur in the femur. The femur is the bone above your knee. It's also called the thigh bone. Tibia, also called the shin bone. The tibia is the larger of the two bones below your knee, and the fibula is the smaller of the two bones below your knee. It's also called the calf bone. Your three leg bones are the longest bones in your body. The femur is the longest and strongest. Symptoms of a broken leg. Because it takes so much force to break it, a femur fracture is usually obvious. Fractures to the other two bones in your leg can be less obvious. Symptoms of breaks in all three might include severe pain increase with movement, bruising, swelling, legs appears deformed, legs appears shortened, difficulty in walking or inability to walk. Causes of a broken leg. The three most common causes of broken leg are trauma. A leg break could be the result of a fall, a vehicle accident, or an impact while playing a sport, for example. The second cause is overuse. The repetitive force of overuse can result in stress fractures. And the third cause is osteoporosis. That is a condition in which the body is losing too much bone or making too little bone. This results in weak bones that are more likely to break. Types of broken bones. The type and severity of a bone fracture depends on the amount of force that caused the damage. A lesser force that exceeds the bone's breaking point may crack the bone. An extreme force may shatter the bone. Common types of broken bones include transverse fracture. The bone breaks in a straight horizontal line. Oblique fracture. The bone breaks in an angled line. A spiral fracture. The bone breaks a line encircling the bone, like the stripes on a barber pole. This is usually caused by a twisting force. Another type of broken bones are comminuted fracture. The bone is broken into three or more parts. A stable fracture. The damaged ends of the bone line up close to the position before the break. The ends don't move with gentle movement. Treatments for a broken leg. This can include open fracture. The skin is pierced by the broken bone or bone emerges through a wound. Closed fracture, the surrounding skin isn't broken. Incomplete fracture, the bone is cracked but not separated into two parts. The complete fracture, the bone is cracked but not separated in. No, the bone is broken in two or more parts. Well, the primary treatment for a broken bone is to make sure the ends of the bones are properly aligned, and then to immobilize the bone so it can properly heal. This starts with setting the leg. Well, the treatment can include surgery, medication, physical therapy, and more. That's all. A bruise. Black and blue marks are often associated with bruises. A bruise or contusion appears on the skin due to trauma. Examples of trauma are a cut or a blow to an area of the body. The injury causes tiny blood vessels called capillaries to burst. Blood gets trapped below the skin's surface, which causes a bruise. Bruises can occur at any age. Some bruises appear with very little pain, and you might not notice them. While bruises are common, it's important to know your treatment options and whether your condition warrants emergency medical attention. Conditions that cause bruises. Most bruises are caused by physical injury. Some underlying conditions may make bruisings more common. For example, sport injuries. Sport injuries are those that occur during exercise or while participating in a sport. They include broken bones, strains and sprains, dislocations, torn tendons, and muscle swelling. Sport injuries may occur from trauma or overuse. Another condition that causes bruises is the concussion. This is a mild traumatic brain injury that can occur after an impact to your head or after a whiplash-type injury. Symptoms of a concussion vary depending on both the severity of the injury and the person injured. Leukemia. This term is used to describe multiple types of blood cancer that occur when white blood cells in the bone marrow grow out of control. Leukemias are classified by onset and cell types involved. Common symptoms include excessive sweating, especially at night, fatigue and weakness that don't go away with rest, unintentional weight loss, bone pain and tenderness. Von Willebrand disease is another cause. Von Willebrand disease is a bleeding disorder caused by a deficiency of von Willebrand factor. Head injury. This condition is considered a medical emergency. This is any sort of injury to your brain, skull or scalp. Common head injuries include concussions, skull fractures and scalp wounds. Head injuries are usually caused by blows to the face or head or movements that violently shake the head. Another cause is the ankle sprain. This is an injury to taut bands of tissue that surround and connect the bones of the leg to the foot. Well, others are the muscle strain, hemophilia A, the Christmas disease, the factor 7 deficiency, the factor X deficiency, and others. We can classify the bruises in two types based on their location on your body. Subcutaneous bruises occur just beneath the skin, and intramuscular bruises occur in the underlying muscles. And periosteal bruises occur on the bones. What are the symptoms and signs of bruises? Symptoms vary depending on the causes. Discoloration of the skin is often the first sign. Bruises can also be red, green, purple, brown. Other symptoms can be bruising that occurs after a hard blow of fall, bruising for no reason, bruising that fails to heal after 4 weeks, bruising under your nails that's painful. That's all. What is cancer? Cancer is a broad term. It describes the disease that results when cellular changes cause the uncontrolled growth and division of cells. Some types of cancer cause rapid cell growth, while others cause cells to grow and divide at a slower rate. Certain forms of cancer result in visible growth called tumors, while others, such as leukemia, don't. Most of the body's cells have specific functions and fixed lifespans. While it may sound like a bad thing, cell death is part of a natural and beneficial phenomenon called apoptosis. A cell receives instructions to die so that the body can replace it with a newer cell that functions better. Cancerous cells lack the components that instruct them to stop dividing and to die. As a result, they build up in the body using oxygen and nutrients that would usually nourish other cells. Cancerous cells can form tumors, impair the immune system, and cause other changes that prevent the body from functional regularly. Cancerous cells may appear in one area, then spread via the lymph nodes. These are clusters of immune cells located throughout the body. The causes are many, and some are preventable. One of the causes can be heavy alcohol consumption, excess body weight, physical inactivity, poor nutrition, for smoking cigarettes. Other causes of cancer are not preventable. Currently, the most significant and preventable risk factor is age. According to the American Cancer Society, doctors in the United States say 87% of cancer cases in people age 50 years or older. Is the cancer genetic? Genetic factors can contribute to the development of cancer. A person's genetic code tells their cells when to divide and expire. Changes in the genes can lead to faulty instructions, and cancer can result. Genes also influence the cell's production of proteins, and proteins carry many of the instructions for cellular growth and divisions. Treatments. Innovative research has fueled the development of new medications and treatment technologies. Doctors usually prescribe treatments based on the type of cancer, its stage at diagnosis, and the person's overall health. Many of the treatments can be chemotherapy, aims to kill cancerous cells with medication that target rapidly dividing cells. The drugs can also help, but the side effects can be severe. Hormone therapy involves taking medication that change how certain hormones work or interfere with the body's ability to produce them. Immunotherapy uses medications and other treatments to boost the immune system and encourage it to fight cancerous cells. Radiation therapies is another kind of treatment. That's all. Chickenpox, also known as varicella, is a highly contagious infection caused by the varicella zoster virus. Although uncomfortable, most people recover within 1 or 2 weeks. There is a blister-like rash which first appears on the face and trunk and then spreads throughout the body. Although not life-threatening, complications can arise. The fast facts on chickenpox. Chickenpox is caused by the varicella zoster virus. Varicella has an incubation period of 10 to 21 days. Chickenpox is highly contagious. The infection spreads in a similar way to colds and flu. A diagnosis can normally be reached by observing the signs and symptoms. But the symptoms are, before the rash appears, there will be a general feeling of being unwell, fever, which is usually worse in adults than children, aching muscles, loss of appetite, and in some cases another symptom is a feeling of nausea. After the rash appears, there will be the rash itself. Severity varies from a few spots to a rash that covers the whole body. Spots. The spots develop in clusters and generally appear on the face, limbs, chest, and stomach. They tend to be small, red, and itchy. Blisters is another symptom that can develop on the top of the spots. This can become very itchy. Clouding. Within about 2 days, the blister clouds over and starts drying out. A crust develops. During the whole cycle, new waves of spot can appear. In such cases, the patient might have different clusters of spots and varying stages of itchiness, dryness and crustiness. Other symptoms in a few people have more severe symptoms. For example, the skin around the spots or blister becomes painful and red. And there also are breathing difficulties. The treatment. Chickenpox generally resolves within a week or two without a treatment. There is no cure, but you can prevent it. Pain or fever. Tylenol, which is available to purchase in different places, may help with symptoms of high temperature and pain. It is important to follow the instruction provided by the manufacturer. Avoiding dehydration, it's important to drink plenty of fluids, preferably water, to prevent dehydration. Another treatment is the mouth soreness. Sugar-free popsicles help ease symptoms of soreness. If there are spots in the mouth, itchiness can become severe, but it's important to minimize scratching to reduce the risk of scarring. Prevention. For children, 2 doses of the varicella vaccine are given, one at 12 to 50 months and one at the age 4 to 6 years. These are 90% effective at preventing chickenpox. That's all.